All right. So, as you guys can see in the top left corner, we've started live streaming. So, welcome to today's meeting. It's been quite some time since we've had a meeting. So, thank you guys all for being here. I appreciate your time. Today, we have two presentations. We have our representatives from the Resource Counseling Center and then Seek Counseling and Resource Services. They're going to discuss the corporate change happening at their Resource Counseling Center located at 580 77th Street. And then we'll have a presentation by representatives from New York State Department of Health regarding access to health insurance, which I'm sure we're all excited to get some resources on. So without further ado, Donna, take away the virtual stage.
Great, nice to meet all of you. It's actually 408 77th Street.
408. Sorry.
Yeah. And we've been there about 8 years, and we were really doing fairly well for a while. And what happened is the pandemic came, and we were doing everything virtual. And I don't know if you know too much about counseling, but doing substance abuse and alcohol counseling with the person and the family works so much better as an in-person than it does on a computer. And not only that, we didn't really get the chance to test anyone to make sure that they're clean and sober at the time. And everyone was relapsing, as you know. I'm not saying anything different than what's going on in the city. So, we tried to find another management company. We didn't know who we were going to choose and who was going to choose us. And we looked around, and I know Marvin, the owner of Seek, and I know Charles, and their kind of a agenda and their vision is the same as ours. The client comes first, as well as Josephine would tell you, very concerned about the neighbors. We want to be very disrespectful, very respectful, not let people hang out, not let people gather. And we never did. We really, there's always one neighbor, as Josephine knows, that will complain. She reported me once on a Saturday for steam cleaning the sidewalk. So, you're not going to make everyone happy, but we are very neighborhood orientated, very discreet. People who know us, and we're the only ones from 100th Street, 4th Avenue, all the way to Remsen. So we didn't want to close because we felt that would be doing a disservice for the community. So we met with Charles and Marvin and Josh, who are in the business, and we decided we would like to use them, but we hopefully would like to get your blessing and allow also you to know what we're doing there. Kelvin, was that short enough for you?
Thank you. I'm guessing he's saying that's perfect.
Yeah, that was pretty fast.
Do we have any comments from our Seek representatives?
Pardon me. They started, pardon me, Anne Marie, the president, also reminded me as the management company going to be ownership. And I'm sorry for saying that. What we did is we wanted to do the management, see how it worked. We realize it works very well, and then they're going to take on the ownership because we can't pay the bills, basically. So I apologize for that.
Okay.
Thank you, Ann.
So Seek Management is taking over ownership of the Resource Counseling Center. So I guess, Charles, we should hear from you next, and kind of maybe you could share with us your background and what's going to stay the same, what's going to change.
So my name is Charles. I joined Seek Counseling in November. My boss is Josh Greenfield, which has another facility in the Bronx that has 5 years of experience in the addiction industry. He has been doing this for 5 years. And basically our vision is just like Donna said, we have the same vision as our clients and patients come first. We are trying to engage everybody, make sure that everybody comes in, being that we see that's most effective versus doing everything virtual and thing. And basically we, as Donna mentioned, we are trying to be as respectful to our neighbors and make sure that nobody hangs around. And our focus is, as I said, to have everybody come in and make sure that we guide and hold everybody's hand until they're actually good to go.
Correct.
And that's more or less it.
Yep.
Okay, so could you tell us maybe a little bit of the types of services, your hours of operation, what's going to stay the same, what's going to be different?
So at this time and point, everything is going to stay the same. We're an outpatient facility. Our hours are at this point, we're 10 to 6 from Monday, Tuesday, and Thursday, and 10 to 8 on Wednesday, I believe. And as the time goes on and we feel that our clients can use some earlier services or later services, then we'll adjust them accordingly.
Okay. So I'm guessing the staff is also going to stay the same, correct? At the resource?
We have hired new staff. We're adding staff as we are growing and feel that it's necessary. We're actually doing individual sessions and we're doing groups as well, as we feel that the groups are extremely effective as well.
And some of our staff actually have left for whatever reason, they have. This field is notorious for going through staff. We're pretty good at Christmas reason. We have the same staff since we've opened. It's what it's like, guys. I mean, it's a hard thing, but Charles got some good staff. We help them get staff. We manage their staff along with them, and we're teaching them the ropes, so to speak.
A lot of people left.
Come here.
A lot of people left because when we were doing the virtual, they felt safer. I cannot, keep somebody if they don't want to be face to face, but it's more effective because the individuals feel like they can be held accountable. And if you give them taxes and it just makes them have structure, feel accountable, and they like the face-to-face, like instead of the on camera, and they have to be careful on what they say and where they are, and they have to whisper, that they could actually sit down,
Be
relax,
themselves. Yeah.
and be themselves
Mhm.
and speak freely when they're in face-to-face. And they have a sober support group when they have the groups. They find people that are in the same situation they are in, and they get sponsors and go into a sober network from our facility. And we want to keep that going, and we want to have their families, their significant others, or if they're living with their parents, we want them to have collaterals and help the community all as one, get their child or loved ones back into, being working and
Living
having
life.
a normal
Life,
day-to-day
right,
life.
right.
We also give them the opportunity to work for us. So if we have them, sober for a certain amount of time, we still have the training center next door from the clinic, and we give them the opportunity to start being a recovery coach and then working in our facility as a recovery coach. So, and then going through the CASEC school if they're interested, and giving back to help others in the same situation they're in. So this is what we've been trying to do, and some people are still scared, as you know, and there's a lot of stigma out there still, but we're losing our loved ones and our family members and significant others to this disease. And as you know, you may not know, I lost my son to a prescription overdose in 2011, and my son didn't have the opportunity to get what we're giving now. And if we had more of it that we're bringing to the community now, he might have still been here. But I was left this journey to make other individuals come and get the help and show the compassion and the caring and the love and the hope that they can move forward and pass this. So there's a lot of things that, as Charles could tell you, that have been guiding and
Involved on a day-to-day.
every day. And and we've been working together, and he's been learning and I've been learning throughout the process. And we're just, it's an everyday process of learning and I think we're actually building up the Bay Ridge again, and we have great counselors on board again, and we are, doing what we have in our hearts, what we have to do.
Yeah. Thank you so much for giving us that information and sharing that story with us. We thank you guys for all the work that you're doing.
Thank you.
Yeah. Do we have any other questions for them, both the Resource Center and the SEEK representatives?
Dr. Maui has a question? Or,
Yes.
and then you, Joe. Let's Dr. Maui and then Joe.
Okay, no problem.
Great.
Yeah. Hi, Donna. How are you?
Hi, Doc.
Okay. Do you still accept Arabic and Muslim patients in your center? And do you have any exact number of how many they could be? And the situation is the same like before, because I used to know that they are, as you know, they are refusing to participate, the families, I mean the parents. So are they still the same, or the situation is different?
Well, it's the same but different. In other words, Dr. Judah, when we have in Staten Island, they can live here also for free. So we just had those 3 Muslim boys that left. We bring them here for to live, and we have the treatment here. It all depends what their housing is like. I don't think we even have one right now in Bay Ridge, Muslim or Arabic, only for the fact that we haven't had many people at all, but they've been coming here to Staten Island and living here. And I would love you, Dr. Ramawi, I know you for a long time, come and see this place. You wouldn't believe what we do here. And it's free for people.
Yeah.
So and they live here, and they get their counseling, they get their family, they get their education, they get jobs. All our employees here almost went through all our program.
What's the address again? What's the address again there?
Here in it's 4521 Arthur Kill Road. We have the whole entire building. We have living on the 2nd floor, treatment on the 3rd floor, recreation, everything for them. I'd love, me, I'd love for you to come and see it. It'd be very beneficial for your community also.
Right.
Okay.
And once they complete our program, they'll continue they could go back home, or we get them in sober living, and then we send them back to seek counseling.
We have sober living too, that when they get a job, they can live away from here, pay rent with the rest of the sober people.
Right. We try to give them, responsibility to not go back to mom and dad's house, not bring them back into the same environment that they kept on repeating the same cycle.
We have, just to tell you, since we've opened, we have an 85% recovery rate of 2 years or more here. So you're talking, if you take a person, we have one kid lived there for 3 years for nothing and worked and paid and saved his money, got his own place. And we got to not only take the drugs and alcohol away from, we have to show them how to live and right in the beginning, when they're recovering, all they want to do is use again. So we're keeping them away from that.
Right. And you should understand this, that there are a lot of families that are Muslim and Arabic that don't even, it's a hush hush. They don't believe in it. They don't want anybody to know. And Dr. Judah actually has to come with me and Donna and sit down with the family. And we're trying to open it up, and little by little it's happening, but it's difficult. And you really need, we could have, special events or a community get together that we could actually do an education.
What I did at the time, what we did at your school.
Right. And maybe listen to like a mother that lost a child, or someone in recovery that has, we're all humans, we just because they have this disease, that it doesn't make them different than me and you.
Correct.
And there's nothing to be embarrassed of. It's the stigma that needs to be removed from this, because we're losing so many because of this stigma. And sometimes it's religion, sometimes it's not, sometimes it's embarrassment. It just needs to, So we
Well,
would
if you
love to
needed,
see
if
more
you
involved.
needed any help, especially with families who don't speak English good, you could call me anytime.
Great,
great.
I still have your cell, big guy.
Good, good.
Our next question is from Joe, I believe.
Yes, Joe?
Yes, yes. I was wondering how many clients or patients do you still have at 77th Street coming?
Charles?
Charles?
We have active, I believe, off the top of my head, roughly about 47, 48 active as of today.
That's
And
great.
they come on a regular basis, weekly, or?
Some of them come a few times a week. We engage every single one. I share with my clinicians and my staff a shared sheet, a document that we can actually see who was outreached every day and when their next appointment is, and when was the last day of service. And if they don't answer the phone, then we follow up we send them a text message and we send them reminders that you missed your appointment and we would love to see you in and come in again. And we try to outreach every single day, whoever didn't show up for their appointment.
So they should be coming in every day, ideally.
That depends on the situation.
It all depends on the treatment. It all depends on what, if they're working. But they liked in the beginning, to do a very productive every day until we get them connected. Then once they're connected, then they decide, well, I only need 3 times a week. We don't force people to treat, but this is a volunteer, open door in, open door out.
We also have peers.
We have peers, a lot of peers we pay that are in recovery and sit down with them anytime, 24/7, and help them through whatever they're going through.
Wonderful.
Okay.
Okay,
I have another question, Charles. So from, as you're going to be taking over ownership of the 77th Street location, are we going to expect anything different in terms of the office itself? Is the sign going to change? As soon as a new sign goes up, we get calls and questions. So I'm just want to get an idea. So will it now be Seek Counseling? Will you retain the name, the Resource Counseling Center? How will that work?
No, so we're going to change the name of Seek Counseling. I don't know exactly till when it's going to happen. We're not in the rush to take off the resource. We love the resource staff and people, so we're not in the rush to take it off. But eventually we're going to change the sign and the name. And for the time being, I think everything is going to stay as is. We're not going to do any construction or anything. Everything is going to stay as is until we actually feel there's a need for adding or taking away anything. If we need more offices, if we need a different, bigger conference room, if we need group rooms, and we'll play along as it plays itself out.
Right. And so you're strictly going to keep just counseling services. Is that correct?
That's correct. Outpatient counseling services.
That's all we're allowed, Joe.
Okay.
So yeah, that's a good question for sure. There's no methadone there, so don't get it's going to be exactly the same, no change.
Well, we know once the sign changes, we'll get
Oh
some
yeah,
questions, so.
I understand that. Good.
So that's a good reason. That's a good reason not to change the sign.
Very good.
No. I mean, we just want to, be prepared for questions.
Clear.
And community concerns. Yes.
Of course.
Are there any other questions?
Well, excuse me, it's Joe again.
Yes. Go ahead.
The comment was made about the young men going to Staten Island in the facility there for so long and all. Now, the word was brought up free. Now, we know nothing in this life is free. This is through Medicaid or through insurance companies, correct?
It's free. Medicaid will pay for their counseling, but does not pay for their housing.
Right.
So when they eat and they sleep, it's all free. I never use that word unless it's true.
That
So
money comes
Medicaid
from
does
like
not
grants and donations.
We haven't been
funded since 2019.
Okay.
So we have other programs that bring in money, thank goodness,
Yes.
So Donna, you're saying that your program is not considered under the congregate care Medicaid.
No.
They're only coming in with community Medicaid for medical insurance treatment purposes, but not for the room and board aspect.
So
Correct.
they get HRA for their spending money and their food stamps.
Correct.
That's what they get for.
No rent housing support.
Nope.
Or not congregate care like an adult home, not.
No.
Okay, got it.
I'm the only adult here.
So, it's, if I did get licensed with my beds, which I don't have to be, it's like a recovery living. I would have to be bounded by a time frame for the clients.
Right, they weren't allowed to stay.
They say, okay, you have 3 months. If I get in licensed under a rehab book, you're only allowed to stay 28 days.
Yeah.
Me, as a mother that lost a child, understands that it doesn't take 28 or 90 days to get their life, in order. That them learning who they are again and having that love for themselves. It takes time. It takes time to learn how to live again and learn who they are and how to love themselves again.
The only reason we didn't get licensed for that is restriction of time spending with us. We don't let anyone leave until they say they want to leave. We encourage it at times, but only for the fact is, we don't want it to be a crutch, but some people just are not ready to go home to the same insanity that they came to us with.
Right. And some people stay here for 8 months or longer.
Yeah.
But we get them the jobs, we get them housing if they need it after this, if they don't want to go to the sober living. And, we get them, we if they don't have their diploma or GED, we get them, we have someone here to study with them. We schedule their test.
Mhm.
I have a book that I buy every year, updated book, and we work on the GED and training with them. And, we sign them up for union jobs. If they want union jobs, we go through the whole process with them. You know what? I want to give back to every parent and every child that I didn't
Took away from you, right?
and my son did not get. So I'm doing things, and I just had the governor's office at my facility, so they know what we do. And I said, we don't get paid for Medicaid for getting people's insurance. People come in here, don't have insurance. We get them the insurance.
Yeah.
We even do that in Bay Ridge. If a client does not have insurance and they need outpatient services, we get them.
We don't turn them
have a
away. We don't
representative
turn them
that
away.
gets them insurance.
Right.
If a client needs more help than outpatient, needs more steady, something more intense than outpatient, and they cannot go to a detox or rehab, and it didn't work for them, they can always send them to us, and then we can send them back if they want to go and continue their counseling at the resource seek. So we work together as a community. Whether I'm in Staten Island, I was born in Brooklyn and I came to Staten Island. I don't see that, I don't differentiate. We're all one, and we all have the same issues and problem going on.
Absolutely. Are there any other questions that we have? Going once, going twice. Okay, Josephine, other questions?
Kelvin, I'm sorry, I went over.
Thank you. No. Thank you guys so
I'm
much.
a talker.
She never shuts up, this one over here.
It's okay. Mine's gonna be longer. Now I'm just.
Oh, God. Thank you, everyone.
Thank
And
you, guys.
Dr. O'Malley, I'm waiting to hear from you.
Thank you. Take care.
Thank
Thank you. Thank you.
Thank you, Charles. Okay, so Kelvin, that was your signal, I guess, to take the virtual stage.
Okay, I am going to attempt to share my screen so that you can see a PowerPoint presentation, which will help me to stay focused as we talk tonight. So give me one moment here. Okay, is everyone able to see?
Yes.
All right. Okay, so good evening to you all, and thanks again for allowing us a few minutes to share with you a little bit about New York State of Health. And what I'm going to attempt to do tonight is give you just an overview of the marketplace, what's going on, what it is, first of all, who's eligible, how people can enroll, and those sorts of things. And then take some time to entertain questions that you might have. So I'll go ahead. Some of you may be familiar with the marketplace, but we launched in 2013, and I have actually been with the marketplace since its opening, since before We opened in 2013. I work upstate New York primarily, but really have recently moved into a role as the to oversee outreach for the entire state. And so what is New York State of Health? Of course, it's our it's the state's response to the requirement that all states have a health plan marketplace, or as it was called in the earlier days, the Health Benefit Exchange. And so New York State of Health is the marketplace, the official marketplace for the state of New York. The marketplace was designed to be a place where people could come and shop for subsidized and unsubsidized coverage, where they could easily compare various health plan options and get free enrollment assistance when they come into the marketplace. It's the only place where New Yorkers can check their eligibility for financial assistance that comes in the way of federal tax credits and serves to reduce the cost of the monthly premiums. In some instances, people are maybe also qualify for some cost sharing reductions. We have 4 programs really that people can enroll in. Qualified health plans. These are the private plans that are offered on the marketplace, and these come again subsidized and unsubsidized based on people's income qualifications. Then we have the essential plan, which I'll talk about in a little bit more detail in a moment. But the essential plan is our basic health program, which is allowed in the Affordable Care Act law for states that operate their own marketplaces. And just to do a brief aside, when the ACA passed and the requirement came for states to have a marketplace, some states opted to run their own, set up and run their own marketplaces. Some states opted to enter into a partnership with the federal government to run their marketplaces, and then in the rest of the states, the federal government runs those marketplaces entirely. So again, we are one of, I believe, 13, maybe 14 now states who operate their own marketplaces. We also sign people up for Child Health Plus through the marketplace and Medicaid. This is not the place, however, for folk who are looking for Medicare. So once they're 65 and older, this is really not the place where you want to come for coverage. And it's not a good place to come, really. Some people have thought that maybe they could come here and get like a supplemental plan. It really would not be advantageous to do so, because you'd be coming and purchasing a plan at the full cost, full premium. There would be no financial assistance in that case. So the marketplace is available to New York State residents who are lawfully present. Having said that, we know that the immigration situation, demands that people have some access to coverage as well, folk coming from other places. And it's a little bit more complicated, but we do ask people to come and apply and just to see what they qualify for. And in some cases, kids may qualify for something, even if parents don't. And, emergency Medicaid and that sort of thing may be available for folks. So, and down in the city, there are some other resources that are available as well. So, so just a little bit about the marketplace and where we are today. Since we opened in 2013, more than 6.5 million New Yorkers have enrolled in coverage through New York State of Health. That's nearly 1 in 3 in the state. And we have effectively reduced the uninsured rate from 10% to below 5% for all ages, and from 4% down to around 2% for children. About 1 million have gained coverage since the implementation of the ACA. And of course, many of you probably know that people typically, and maybe different down in the city, but in most of the state, people went to the Department of Social Services for Medicaid, et cetera. Now all of that comes underneath New York State of Health. So let's talk a little bit about the benefits of New York State of Health plans and what type of financial assistance is available. So what you see before you right now are 10, what we call 10 essential benefits. So these are benefits that are covered in every plan offered through the marketplace, regardless of whether it's the qualified health plan or essential plan or whatever. All of these benefits are available in every plan. And so I won't read the entire list to you, but I'll highlight a few: free preventive care, outpatient services, emergency services, lab and imaging services, prescription drug, rehabilitative and habilitative services, and of course, mental health and substance abuse disorder services, which are offered on par with other medical services. And then you see pediatric dental and vision are also required in the plans. Adult dental coverage may also be available for additional costs for those who are in our some of the plans. I'll specify something specific, something related to the essential plan in just a moment here. Just to talk a little bit more about this, in our first year or so, we found that even though people were getting pretty robust tax credits to help reduce the cost of their premiums, there were still a number of folk who would say, even with those tax credits, they found coverage unaffordable and they would forego coverage. And so this basic health plan really was to kind of help cover that gap between those individuals who were just slightly above Medicaid income qualifications and going into our qualified health plans, but realizing that it was still unaffordable. So it used to be before last year that this was for people on the lower end of the income spectrum here, they would pay zero, and the upper half of the income range here would pay $20 a month. As of last year's state budget, there's no premium for the essential plan. So anyone who qualifies for the essential plan gets it without a premium. And also added last year was free vision and free dental coverage with all of those plans. There's still no deductible, and there's still free preventive care. And again, it covers all the same services as the other plans, which I've shown you on the previous slide. Just to give you an idea of what costs look like, we have a little chart here below that shows you for an individual to qualify, they can make up to $27,180 annually, and family of four can make up to $55,500. Of course, these numbers are updated each year as we get new federal poverty level information. So let's see here. Since the pandemic began a couple of years ago, I guess it's kind of hard to keep track of time, but anyway, the American Rescue Plan was signed into law in March of 2021, and it expanded the income eligibility for financial assistance through the marketplace. And so typically anyone making up to 400% of the federal poverty level would have qualified for some form of financial assistance. Again, talking about the tax credits. And since the pandemic began and this law came into effect, even more people above 400% of the federal poverty level now also qualify for financial assistance. Those individuals who were already enrolled with the marketplace and already receiving financial assistance found that they got even more, and that was automatically applied to their accounts. And then we've made a great effort to reach out to folk who who did not previously qualify, to let them know that they may qualify for some financial assistance for the first time. And folk who may have come to the marketplace, looked at the cost, did not qualify for financial assistance, and decided not to enroll. Where we could, we've reached out to them as well to invite them back to come and take a second look. We know now that most people who apply end up qualifying, not all, but quite a few more people qualify for financial assistance. And again, the law is designed so that no one will pay more than 8.5% of their income towards health insurance. If they find themselves doing so, then they're invited to come to the marketplace to see if they can find something more affordable. I should also add that the American Rescue Plan is in effect through the end of this year. There's a possibility that it will be extended. We don't know the answer to that question yet, but I know it's a question that many have. And I know there are other groups and advocates out there who are pushing for that to be the case. But at this moment, I think that is expected to expire at the end of 2022. Just to give you an example of what the tax credit may look like or how they're helping people. Gonna take an individual in the city making about $35,000 a year, and you can see that they were getting $359 per month in tax credits to help reduce their monthly premiums. With the passing of the American Rescue Plan, they are now getting over $100 more, almost $120 more per month. And so instead of paying $278 per month for their premium, with the American Rescue Plan, they're paying $159 per month and saving around $1,400 per year. Now we'll shift to talking a little bit about how people can use our website to kind of get an idea of what the plans look like. There are many, many, many plans. We have a lot of different insurers in the marketplace, companies that you're perhaps familiar with, but a lot of different health insurance companies who offer plans within the marketplace. Health First, Metro Plus, Fidelis, United, Excellus, Blue Cross, all of these types of plans that are in the marketplace offering different plans at different plan levels. And by plan level, I mean we have bronze level, silver, gold, and platinum level plans that people can choose from based upon their medical need and their finances. So this helpful tool just from the front of our webpage, someone can click on Get Started and put in some basic information about who is needing coverage within a household and household income, county of residence, that type of information. And you'll get a pretty good idea of what the cost might be for you. So if you qualify for financial assistance, it will show you how much financial assistance you might qualify for. And then it gives you another good place to compare different types of plans based on what your needs are. This is also where an individual can really start the whole application process. We did our best to make this application user-friendly, but we understand that health insurance and kind of trying to choose and decipher all the language and related to the different plans can be complicated, and that's why we offer free in-person enrollment assistance in every county of the state. But anyway, these are just some helpful tools. One other tool you'll see here, and I think I have a slide later on that talks about this a little bit more, but people can also, before they choose a plan, they can search to make sure that the providers that they need to see are a part of that plan's network. People will also want to make sure that the medications, for example, that they need to take are part of the plan's drug formulary. So some of the important things that people need to consider as they're signing up. So this screen just shows you a little bit of what I just talked about in terms of people selecting the county where they reside, entering some basic information about the composition of their household and who's needing coverage. And this tool would spit out for them some information about what tax credits may be available to them. And they get to see what plan costs might look like. So in terms of when and how an individual can enroll in a plan, we know that folk who are eligible for Medicaid, Child Health Plus, and the Essential Plan can enroll anytime during the year. So they're not subject to the typical annual open enrollment period that consumers who qualify for the qualified health plans have to adhere to. Currently, actually, since the pandemic began, we have extended and extended and extended and extended, such that open enrollment has really been continuous since the pandemic began. And we can tell you that it will remain open as long as the public health emergency is ongoing. Right now, we know that the public health emergency is being extended through October. That's as far as we know at the moment. It could be extended again. We just don't have that information. Those decisions are made at the federal level, and we're informed. But as long as the public health emergency continues, I think we should expect that open enrollment will continue as well. Outside of our typical annual open enrollment period, individuals might qualify for a special enrollment period if they have a qualifying life event. These could be things like marriage, birth of a child, death, relocation, or loss of health insurance for reasons other than not paying one's premium. So if the public health emergency ends, the COVID public health emergency ends in October, we would still be starting open enrollment again the following month, November 16th. And typically that would go through the end of January of the following year. Excuse me. Now, it is important to realize that you may hear or see commercials or information about what's going on with the federal marketplace. Our timelines are not always the same. So we have done our best to give consumers additional time to enroll. And so our open enrollment period tends to be longer than the open enrollment period for the federal government. So just make sure if you're sharing information with consumers that you're helping, that you are getting the information directly from New York State of Health, not from healthcare.gov, which is the federal marketplace. We have made a lot of efforts, again, to assist New Yorkers during the pandemic. And we have even started co-locating many of our efforts with our with the vaccination program as those have been rolled out. And so, we found out that there were people who would go to get vaccinated who would report that they didn't have health insurance. And so it just made sense for us to try to be there where possible to be an answer to that void in their lives and go ahead and get them set up with coverage. And so we try to have that information available or to have representatives available at many of the events where vaccinations are taking place, or if we have outreach events or things that we're participating in when it's possible, or the venue or the organizers can accommodate us, we also try to have a vaccine team to help out. So I'm not going to read more of this slide, but we do want people to know that we're here to help them out if they need coverage. So let me give you a little bit of information about how deadlines work here. Typically, if one applies for coverage by the 15th of the month, they'll have coverage effective by the 1st of the following month. If they enroll after the 15th of that month, they'll have coverage available by the 1st of, like in this case, so enroll by June 15th, you have coverage by July 1st. If they were to enroll by June 16th or later, that coverage would not be available by July 1st, but would move into an August 1st effective date. And so I think you get the picture here. In terms of enrollment assistance, people can apply, as I've already mentioned, online on our website. People can call our customer service center. And in addition to getting their questions answered, they can also completely enroll in coverage over the phone. And then, of course, our enrollment assisters, we have literally thousands of enrollment assisters across the state. We have people located in every county of the state. Many of these folk are providing assistance in language, more than 38 languages. And essentially through telephonic interpretation services, we can also provide assistance to New Yorkers in virtually any language spoken in the state. Again, this assistance is always provided at no cost to the consumer, so they should never, ever, ever pay for help getting enrolled in the marketplace. And just to talk about our enrollment assisters, we have organizations that are under contract with us to provide enrollment assistance. These we call our navigators. And then we also have a number of other enrollment assisters from health plans and from other organizations who have some interest in seeing people get health insurance. Many hospitals may have enrollment assisters that we call certified application counselors, or CACs. And then the plan reps and the health plans will also many times have, I'd say in every case, the health plans will also have certified enrollment assisters. And they can help people with both our individual and families marketplace and also small business marketplace, which I probably should have mentioned up front, that the marketplace has two components: one for individuals and family to enroll in coverage, and then we also have a place where employers might come, small employers may come to get coverage for their employees. Just to give you a sense of how people enroll, we know that almost 80% of the folk get their help through one of our enrollment assisters or certified enrollers. And then we have a little bit of a schematic here that shows you how that is broken down. In terms of navigators, 471. We have over 5,000 certified application counselors, and we have nearly 1,700 insurance brokers who provide enrollment assistance. To learn more about New York State of Health, we have tons of resources on our website, and I encourage you to visit the website and take a look around. We have educational videos, we have print materials, all of which are downloadable from our website as PDFs. You can print them yourself, but we also have a process through which you can order materials. If you want to have some in your organization, those will be mailed to you at no cost. We have an order form on our website. You simply complete the order form and send it to the email address that's posted there. And typically within about a week or so, we'll get those materials out to you via mail. And again, you'll find that there's some limitations in terms of quantities. We try to manage the inventory as best we can so we can make sure that people all over the state have access to the information. But yeah, feel free to take a look around and look at those videos. The videos are, some of them are instructional about, how to complete the application, for example, or those sorts of things, or, for folk who got additional tax credits with the American Rescue Plan, if people needed to go in and take some sort of action, there are instructional videos related to that. And then we also have videos that are educational, things like, that talk about why the importance of health insurance or the value of health insurance, or videos that would define some of the terminology that's often used when we're talking about health insurance, things like co-pays and deductibles and those sorts of things. So a host of resources that are on the website that, again, I encourage you to take a look at. What you're seeing to the right here is an example of one of our at-a-glance cards, which we have for each of the 4 programs, the Qualified Health Plan, Medicaid, Child Plus, and Essential Plan. It's just a card that has a front and back that gives you a quick overview of the program and some of the important information that needs to be considered. We have fact sheets, we have rack cards, posters, and other things available. Our materials are available in 27 languages, so English plus 26 other languages, which you see listed here. Here for the state of New York, we have 10 languages that we have had to translate materials in, as we have an executive order that mandates this. I just learned this week that that's now going to be 12 languages. So we will add French and Urdu. They'll move up to the required languages, which means that all of our essential documents will be translated in those languages. our core documents will be translated into all 12 of those languages. And you see 11 because we've split Chinese into simplified and traditional Chinese. I talked about provider and health plan lookup tool. Again, this is a way for people to make sure that they are enrolling in a plan that takes their that covers their I can't talk. Make sure they're enrolling in a plan that is accepted by the providers, the facilities, the doctors that they need to see. And we also have a tool on our website where people can search for an enrollment assister. They can, use this tool to filter out some information. So if they know the person's name, they can use that to find information. If there's a particular organization, navigator organization, or that they want to reach, they can find them this way, or a broker or whatever. Or if they're just looking for somebody in the county or in a zip code close to where they are that they can meet with, they can find them through this resource. And so I will stop there. You see, we are on social media, and we have a lot of resources that are shared via these social media channels. I'll stop there and entertain questions.
Thank you so much for your presentation. Do we have any questions? I do have to say, I checked online since we're live streaming this, and the slides do show on the live stream, but if you can also email us the presentation, that would be really helpful so we can share with the rest of our board members.
Sure thing.
Yeah. Are there any questions? Any raised hands? Going once. Josephine, I think you're speaking.
Yes, I'm speaking, but I was on mute. Once the pandemic is over, I'm going to get this down. Calvin, I just want to say thank you too for the presentation. When the marketplace first opened, I remember the board office being flooded with calls, and that's really kind of dwindled down because I think the team at New York State DOH has done a great job in getting out the word and having many locations where to sign up. Do you know the statistics? I know you gave statewide statistics. Is that filtered down by community district or by borough in terms of the numbers that are not currently under any of the plans that are out there?
I don't know them off the top of my head, but I can tell you that using the American Community Survey, CDC data, we do know that there are certain areas of the state where uninsured rates are higher. Those are typically concentrated down in the city. So for example, we have we make concerted effort to do more in Bronx and in Queens because we know that there are pockets of higher uninsured well, let me say that differently. We know that in those boroughs that we have pockets of uninsured folk there to the degree that's higher than in other parts of the state or in other parts of the city even. So we are doing everything we can to invite organizations to partner with us to help us to get the message out. And of course, as you saw in one of the earlier slides, we've reduced the uninsured rate. So we're talking about getting to the hard to reach, but we invite folk to work with us to get the word out. And we've done what we can to try to make that simple. For example, on our website, we've developed like an outreach toolkit that our partners can use. So for example, if you do a newsletter and you want to have some text that you can drop into a newsletter, we have sample newsletter copy. If you want to post something on social media, we have sample social media posts that you can grab. Right now, our really big push is to make sure that folk understand that after the public health emergency ends, they will need to take action. So for these last couple of years during the pandemic, people have not really had to take action. Like their coverage has just been extended up, like kind of renewed.
Right.
But when the public health emergency ends, they will need to take action, and we don't want anyone to have a gap in coverage because they missed taking action. So we've actually initiated a texting campaign, START, basically, that allows people to to voluntarily receive text messages that will specifically come to them to tell them of actions that they need to take in order to make sure they don't have gaps in coverage.
Great.
And, we worry about people who may have relocated or whatever, or just people just saying, I haven't had to do anything in the last couple of years. I'm good to go, and just not paying attention. And so we're starting this campaign, which has already been launched, to get people to enroll in text alerts so that they don't miss out on coverage updates or action that they need to take. So.
Okay, and we can certainly do that here at CB10. We can help get the word out in our news, our e-blast as well. So thank you. Thank you.
And I know you all are working with Stana.
Yes.
And so she can certainly get to you all of those resources. I'll certainly get to you the PowerPoint and make sure that you all can share that with your other members. But yeah, I'm happy to entertain any other questions if you have them. And again, grateful for the time to present to you this evening.
Thank you so much. And it's always great the more ways we can share this information via technology, the better it is, especially nowadays as the numbers start to rise again and everyone's at home. Do we have any other questions? All right. I think that is the end of the meeting, correct? Yes, I see a yes. Okay, thank you guys all so much for coming. I really appreciate your time. And I'll see you guys next month at our community board meeting.
Okay, thank you.